Are you a kid dealing with OCD? Obsessive thoughts are very overwhelming. I'm going to talk to you about how to handle them and reduce your OCD symptoms. Stay tuned, that's what's up next. Welcome to another episode of Ask the Child Therapist, Kids Edition, where every week I make videos to help kids with anxiety and OCD learn to survive and thrive. If you like videos to help you with this, don't forget to hit like and don't forget to hit subscribe or the bell to be notified when new videos come out every Thursday. Are you struggling with OCD? Well, you know, OCD is a lot more common than you might think. In fact, 1 out of 200 kids have OCD. That's actually more kids with OCD than diabetes, which I think is pretty crazy. So you're not alone. It's just that kids don't go around talking about it. They don't go around advertising, hey, my name's Bob, I have OCD, what's your name? We don't do that. But it is very common, and there's a lot of people who are probably in your class, in your school, who are struggling with you as well. I want to help you. And the first way that I can help you is to help you understand what OCD is. That's really important, because OCD is kind of a mystery. And if you don't understand how to demystify it and understand what's going on in your mind, then you're not going to be able to fight it. So I actually made a video on that, and you don't have to sit here and listen to me talk. You can go watch this video and it will explain what OCD is and how it works. So put this on pause, go watch that video and come back, because I really want you to understand what OCD is first. Today, I'm going to talk to you about how to deal with obsessive thoughts. When your obsessive thoughts, those uncomfortable, horrible, thoughts, want you to do something. So for most people with OCD, not all, and we will talk about the other half or the other quarter in another video, but today I'm going to talk to you about when you have an obsessive thought, a thought that makes you feel really, really miserable, and it wants you to do something. Because for most people with OCD, that's how it works. You have a really scary, bad thought, an uncomfortable thought, and then OCD says, hey, I know how you can fix this. There's a really simple way. Just go do this and you'll be fine. Just don't do this and it'll be great. And that is pretty much how OCD works for the bulk of people. We will talk in another video about that small percentage of people with OCD where it doesn't work that way. But today I want to talk to you about how do you deal with that. So no matter what type of OCD you have, because there are a zillion different types of worries that pop up in people's minds that are different names, and we'll go over different ones in different videos, the main thing is pretty much the same thing. I'm going to make you really uncomfortable. I'm going to freak you out with a thought that's not going to make any sense, no sense to you, no sense to your parents. And I'm going to say, you know what? There's an easy way to fix this. Go do this or stay away from that and you'll be fine. So you might say, well, okay, Natasha, what's the problem? If I'm having this really, really scary thought, all I have to do is this thing. So what is that thing? A lot of times it's going up to your parents and asking for reassurance. So maybe you have to go up to your parents and you have to say, you know, I'm having this thought. Does that mean I'm a bad person? Or I'm having this thought. Am I okay? Or I'm having this fear. Is this safe to touch? Is this safe to eat? Am I safe? So a lot of times the thing that you have to do, which in the fancy term is called a compulsion. So a lot of times the compulsion is actually just checking with your parents. But as you get older, and for a lot of other kids, it might be washing your hands, it might be cleaning, it might be checking things, it might be counting, it might be tapping. It doesn't matter. All that matters is it's something that your OCD told you to do, and so you're trying to do it. And unfortunately, if you do it, this is the bad news. Are you ready? Drum roll, please. It grows bigger. So this is the trick with OCD, is that it makes you think that it is going to be relief. It makes you think that it's going to make the thoughts stop. It makes you think that it is going to get better if you do or tap or wash or check or ask somebody. But in reality, when you do that, you're growing your OCD and you're actually changing your brain and you're making that OCD, the neural pathways, I call them the neural highways, you're making them stronger. So every time you have an obsessive thought, And it says, just go ask your parent. Just go ask your parent again. You know what? Tell your parent you're having this bad thought. Google it, check it, go wash, go tap, go clean, go organize, whatever it's telling you to do, because it'll be different for each person. It's fooling you. It's lying to you, and it's growing bigger. So what do you do with that? Well, for starters, when you have an obsessive thought, you want to acknowledge it. And so you want to say, hello. I hope that you've named your OCD. I'm very big on naming things, so I hope that you have some weird, funky name for it. So call it something. For this video, from now on, we're going to call it O. But you can call it O liar, or call it a dictator, or call it a boss, or call it obnoxious, or you can call it something particular to your different type of OCD. But you want to call out your O and say, I'm having an O thought. It looks like O is trying to upset me right now. Well, the first thing is when you have an obsessive thought, sometimes people get really upset that they're having the thought. And so they fight to try to get rid of the thought. But when you fight to get rid of a thought, it actually grows bigger. And so it's better to accept the thought and acknowledge it and say, greet it and say, well, hello, O. How nice of you to join me. I'm having an O thought right now. This is not my thought. This is an O thought. Because for some of you, your OCD thoughts are going to be very upsetting and they're going to make you think that you're a bad person. Some of you won't have an OCD thought that does that for you. It will just make you feel nervous and scared. But for some of you, those thoughts are going to be really, really upsetting and they're going to make you think that you're a bad person. And so the first step, no matter what, whether it does that to you or not, is to acknowledge it and call it out and say, I am having an OCD thought. Hello, O. We talk about always naming it. I'm having an O thought, and this is not my thought. This is OCD trying to play a trick on me. And so you're not fighting it because you can't get a thought out of your head. If I told you right now, hey, whatever you do, don't think about a huge giant pizza in your room falling through the sky. I bet that's what you just imagined. Because when we try not to think of something, pizza, we think more of it. That's just the way our brain works. So when you say, no, O, I'm not going to think about you, guess what your O does? It grows bigger. Thanks. You don't want to think about me? So you don't want to fight it. You want to acknowledge it and say, okay, I'm having an OCD thought. My O is here. What does O always want me to do? It lies to me, it tricks me, and it wants me to do something for most of you. And so what does it want me to do? When I'm having an O thought, what's the action it wants me to do or avoid? Sometimes it may want you to avoid touching something, eating something, or going somewhere. And sometimes it wants you to do something. Ask your parent for reassurance, ask your parent if it's okay, wash, clean, wipe. It is really different for each person. But if you're having an O thought and you're instantly wanting to go do something, either in your head or in real life, then it's OCD. So in a perfect world, it would just be great if you just didn't do it. Just don't do the compulsion. That would be great. But unfortunately, it's not that easy. Otherwise, people would just stop doing it and OCD wouldn't exist. Because OCD only grows when you do the thing or you avoid the thing that it wants you to do. So if you didn't do it, then you'd be done with OCD because it would shrink away and it wouldn't be powerful in your brain and it'd be so tiny, it would have no power and you wouldn't hear it anymore. It'd be like, nah, and you'd be like, whatever, I don't even listen to you. But it's loud because it is so demanding. It is like an itch that needs to be scratched. Have you ever had a mosquito bite and it's so itchy? And when you scratch it, what happens? You can really, really hurt your skin because it feels good in the moment, but you're actually sometimes doing damage to your skin. And your skin can get chapped or it can get raw, it could even bleed, and then your mosquito bite's even worse than it was when you started. That's kind of like O. O makes you feel like this great itch, and as long as you scratch it, you're gonna feel better. But that's the big lie, because the more you scratch it, the more it itches. So in a perfect world, we're gonna want to ignore the itch. We're gonna wanna ignore the obsessive thought, acknowledge it. Hey, I'm having an OCD thought. This is not me. This does not mean I am this person. I'm having an OCD thought, and OCD will sometimes find the most upsetting thoughts because it knows it's upsetting and it will give it to me. It doesn't mean that that's who I am or that that's what I'm thinking. It's my OCD. And so I'm going to just leave it. I'm not going to fight it. I'm going to just leave it and go do a different activity. So getting into another activity when you're having an obsessive thought is very, very helpful and important. Don't just sit there and let OCD bully you. Go and keep your mind busy. Now, if you have a hard time just not doing the compulsion, which most people are going to struggle with, there are a couple of little things that you can do. So if your O is screaming at you, let's say to go wash your hands, we'll pick like the stereotypical one, and it's like, you are dirty, go wash your hands, go wash your hands. Now, it's probably screaming something else to you, but let's just use that one as an example. And you're like, I just have to go. I can't handle this. Well, you could delay it. So look at your clock and see how long you can go without doing it. Maybe set up a challenge and see, can I go 30 seconds without washing? Can I go a minute? Can I go 5 minutes? What's your all-time record? Could you go 10 minutes? Make a game of it. When you delay it, you're still weakening your O. So after you call out your OCD and you're like, this is my O, these thoughts are not my thoughts, these are OCD thoughts, they do not mean that I am this person. And then you try to delay the compulsion and you're like, I'm not gonna go do what OCD wants me to do. Then maybe you can move into ignoring it and say, I'm just not even gonna do it. Now, if you get super, super, super powerful, you can do the opposite of what O wants. O hates that. So for some OCD thoughts, you can actually do the opposite. So if O is saying, ew, don't touch that, that is so disgusting. If you touch that, something bad will happen. Then you might touch it on purpose to poke at O and to say, oh, you know what, O, you don't control me. You lied to me, you make my life miserable, you take up all my time, so I'm gonna touch it on purpose. Or if O says you need to do everything by 2s or 4s, then maybe you're like, you know what, I'm gonna do things by 3s and 5s. And O is like, 3s and 5s, don't do that, that's horrible. So the ultimate weapon is to do the opposite, but this will take time. So to break it down in simplistic terms, you want to call out your OCD and recognize that it's an OCD thought, not a you thought, and it's okay. You can have these thoughts. You don't have to do anything with them. 2, if O is very powerful and is telling you to go do something, go check with your parents, go ask your parents, go wash, you can try to delay it. How long can you delay it? Can you delay it for as long as you can? Do you want to look at your watch and see if you can go 5 minutes, 10 minutes? 3rd, you want to ignore it. See if you can just hold out completely, because the longer you wait, the weaker it gets. And 4th, you want to try to do the opposite. If you're feeling super powerful or you start to do this a lot, then you can do the opposite and poke at OCD and do the opposite of what it wants and really weaken it. So that is a broad view of what I call the OCD game. And I'll go into more detail in another video, but I hope that gives you some idea of how to handle the obsessive thoughts. Now, often parents aren't going to want to help you do your compulsions, because when they do, when they answer OCD, you know what they're doing? They're actually growing your OCD bigger. And so you want to discourage your parents to answer your OCD questions and tell them, don't answer my questions. If I ask you something for O, just ignore me. Because if they answer you, they're answering your OCD and they're growing your OCD bigger. And they may want to help you, but you don't want them to help your OCD. So that is a very big overview. We're going to get into the nitty-gritty in upcoming videos. And if you have a particular OCD theme that you want help with, leave a comment below, because I'm going to be doing videos on anxiety and OCD. And every week I'll alter the different themes, but I want to make sure I'm making videos that will help you. So what does your OCD tell you? What is your biggest obsessive thought that you want help with? Leave it in the comments and I'll be sure to follow up and make a video just for you. I hope you're enjoying these videos. Don't forget to hit like to support them and hit subscribe or hit the bell so that you get notified when new videos come out. New videos come out every Thursday, so I hope I see you next week. If your parents need help, tell them to go listen to my podcast, because that is just for parents and it will help them with the tools that they need to help you. Until next time, I hope you find the sparkle in everything you do. Take care.